Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome and thank you for joining us on our weekly Redefining Medicine podcast. Today, I'm pleased to welcome Dr. Jaclyn Chasse, a naturopathic physician and VP of Medical Education at Elevate at Emerson Ecologics. Thank you so much for joining us today, Dr. Chasse.
Thank you so much for having me, Lindsay. Happy to be here.
Let's get started. Dr. Chasse, you are past president of the American Association of Naturopathic Physicians. Can you tell us a little bit why you chose to become an ND?
So, ultimately it's the approach that they take to medicine, which is that when a patient comes in with symptoms, one, they're not typically just random victims, right? There's a path of disease progression that happens before we even hit diagnosis, right? And a lot of that is linked to the choices that we make every single day. So from a philosophical perspective, that felt like a real match to me. And it was really the philosophy that drew me to naturopathic medicine more than a specific interest in using more natural therapeutics. It wasn't an issue of I wanted herbs over drugs. It was that in my learning at that time, a lot of drugs might mitigate a symptom, but they don't fix the underlying root cause. And then you end up with this polypharmacy over time where you're layering drug on drug to either manage side effects or manage a disease getting worse. And one classic example is like elevated cholesterol, right? Really easy to understand. There's medications that can lower someone's cholesterol value. However, are you really addressing, one, the reason why they're there, which is oftentimes lifestyle related? And then two, are you really mitigating the risk for them? Are you improving their health through the therapy, or are you just managing a symptom? So naturopathic medicine, from my point of view, has a more holistic perspective around that and really emphasizes that find the root cause as a primary tenet of what we do. And it's kind of that investigative work that I really like.
Thank you. You will be leading as a faculty member in the upcoming nutrition supplement workshop taking place on January 23rd. Can you share a little bit about the upcoming educational event and why this is such an important topic for clinicians to study?
Yeah, I would love to. So I'm teaching this course with Dr. Laval, who I'm sure many of you know, and we're going to be working together to really provide a clinician's viewpoint overview on the use of dietary supplements. So Dr. Laval is going to be focusing for a lot of the course on the clinical application of supplements. So if you maybe have been dabbling with supplement use, or even if you feel comfortable with a lot of supplements in your practice, Dr. Laval is going to really teach you what the top therapeutics are, what you should be using for different systems of the body, and really helping you feel expertise in developing treatment plans for patients. My section of the course is going to be really teaching you how to evaluate a brand before you recommend it to patients, meaning, there's literally tens of thousands of products in the marketplace. So how do you choose brands to work with, choose products that are going to be most successful for your patients? How do you communicate with patients around a treatment plan when there are supplements? And then physically, how do you help your patient get access to them? So we're going to talk about different options that are available, everything from building a physical dispensary in your office to doing something online to referring the patient to the store to shop for themselves. And we'll talk about the pros and cons and how to do each of those well. So from soup to nuts, you'll walk away with the expertise on how to build a great recommendation, how to know what to recommend clinically, and then how to physically implement that with your patients.
Thank you. What specific topic within the course are you most excited to unpack with the attendees and why?
I think the biggest piece that I'm looking forward to talking about and really diving into is how to evaluate a good quality brand. It can be very time consuming. And my experience with Emerson, one of my roles there is to own our own quality and own our Emerson quality program. And what that is a program where we are a third party evaluator of some of the brands that we distribute. We invite everyone to participate, but it requires full transparency on the part of the brand, meaning that we walk through their manufacturing facilities to conduct audits on a semi-annual basis. We send their products to our independently qualified labs to validate them. So personally, I've had the experience of walking through dozens of manufacturing facilities and kind of seeing the good, the bad, and the ugly. And it's really eye-opening. It is like making sausage, right? You always want to know what's behind the scenes. Well, I've been there. And so there are brands that we don't distribute any brands that I couldn't feel confident recommending, but there are brands that go above and beyond to really make sure their products are incredibly well regulated, have high integrity, have the best quality ingredients inside, and they really care about it because they know that doctors are utilizing these with patients. And so I'm really excited to share a little bit about what I learned from that process of understanding quality better and really try to distill it down for each person that attends so that it can be a checklist process to be able to validate a brand, and you can feel really confident at the end that you are working with good quality companies.
Dr. Chasse, you have nearly 15 years experience in the field. How have you witnessed this particular area of medicine evolve?
Oh gosh, it's evolved so much, and I think really for the better. I think the level of interest in integrative, functional, naturopathic medicine has skyrocketed, particularly in the last couple of years. When I first became a naturopathic physician, no one knew what it was. And when they would ask me what I did for work and I answered, they would say, well, what's a homeopathic doctor? Or I've never heard of that. Where nowadays almost everyone has recognition of the work that we do. And with naturopaths specifically, they've been around for a really long time. But I think the addition of functional medicine and the rise of functional medicine, the rise of A4M, and all of these conventional doctors who are starting to apply the philosophy and the tools that naturopathic physicians are trained in has really elevated all of us, because now more people out there know that there are alternatives to kind of a conventional standard of care. And the other side of it is that people are so much more wellness oriented, from awareness around nutrition. Look at how the food industry has changed so dramatically with trans fats being banned and organic awareness and GMO awareness. There is so much more awareness among consumers and so much more demand for kind of a healthier approach. And I think that's only going to become even more so as the millennial generation gets older. They're showing a huge attraction to staying well and being proactive about it. So the need for this type of medicine, I think, will only continue to grow.
Thank you so much, Dr. Chasse. We're all looking forward to your upcoming nutritional supplement workshop. We appreciate you spending time with us today, painting a beautiful picture of the workshop, also sharing your expertise with us. Again, we truly appreciate your time.
Yeah, thank you so much. Happy to be here.